talk about causes of penis bleeding. Bleeding from the penis can be caused by a variety of factors, which can include injury, infection, or underlying health conditions. So it is important to determine the cause so that we'll be able to ensure a proper treatment. So let's talk about the breakdown of potential causes. The number one is injury or trauma. Injury to the penis, such as from accidents, sport, can cause bleeding. If there are ruptured blood vessels in the prostate or the seminal vesicle, if they rupture during sex or during ejaculation, it can lead to blood in the semen, right? Then there's something we call frenulum breve. A short frenulum, the thin piece of skin connecting the foreskin of the penis head, can of course tear during sex, causing bleeding. And apart from the injury that we talked about, it could be as a result of infection, like sexually transmitted infection, like gonorrhea, like chlamydia, or herpes, which can cause inflammation and, of course, result to bleeding. It can be as a result of prostatitis, that's the inflammation of the prostate gland, which can lead to bleeding, especially when caused by bacterial infection. And when we're talking about something urinary tract infection, that's the tract through which your urine and the sperm comes out. If there's an infection, it can cause inflammation and bleeding, potentially affecting the urethra and, of course, the prostate gland. And we have various other health conditions. It can be as a result of enlarged prostate, that's benign enlarged prostate, we call it BPH, which can cause bleeding, particularly in older men. It can be due to prostate cancer, though less common. Prostate cancer can cause bleeding, sometimes with a foul smell. Can be as a result of kidney stones or bladder stones. This can cause irritation and bleeding as they pass through the urinary tract, trying to move away from the body. It can be due to blood disorders. Conditions like hemophilia or sickle cell disease can affect blood clotting and clot bleeding from the penis. Or we can talk about allergic reaction. You understand? Maybe due to allergy. Then certain medications too can result in allergic reaction, like Steven Johnson syndrome, which can involve skin lesions and bleeding. It can be a particular syndrome, a rare congenital vascular disorder that cause painless urethral bleeding, especially during erection. There'll just be bleeding. You understand? Then when are you to seek medical advice? When there is severe or chronic bleeding, or if the bleeding is significant or persistent, or it is important to consult a doctor, or when there is painful urination or erection, or when there is pain associated with bleeding, which may indicate an infection or other serious problem. So all the symptoms, if you experience like fever associated with it, discharges or other unusual symptoms, seek medical attention if you are concerned, because health is wealth. And see you in the next video.